Hello, and welcome to this lecture on Principles of Pharmacology. I'm Dr. Omar, and I'm pleased to guide you through this subject. Pharmacology is a fascinating field that explores how medicines interact with biological systems, and understanding its core principles is fundamental to healthcare. Throughout this course, we will delve into various aspects of drug action, therapeutic uses, and potential challenges. Today, we're going to embark on a journey that is particularly relevant in the current healthcare, focusing on how we combat microscopic invaders that can cause illness. Get ready to explore the exciting world of antimicrobial agents and chemotherapy. Today's session is chemotherapy and antimicrobials. This is a critical area in pharmacology, addressing how we treat infections caused by various microorganisms and, in a broader sense, how we use chemical agents to combat infections and diseases, including cancer. We'll explore the principles behind these treatments, looking at how different drugs target specific pathogens or abnormal cells while minimizing harm to the host. Understanding these mechanisms is important for all healthcare professionals, as it forms the basis for effective and safe patient care. Let's dive in and unravel the complexities of these powerful therapeutic agents. Infectious diseases are a major global health concern, caused by pathogenic microorganisms like bacteria, viruses, fungi, protozoa, or parasites. These tiny invaders can be transmitted between individuals, animals, or even through the environment, leading to a wide range of illnesses. Think about common examples: bacterial infections like those caused by Staphylococcus aureus or E. coli, viral infections such as influenza or HIV, fungal infections like Candida, or parasitic diseases like malaria. The primary goal of treating infectious diseases is not only to alleviate symptoms and improve patient outcomes, but also, crucially, to prevent the spread of infection and reduce morbidity and mortality. It's about breaking the chain of transmission and restoring health. When we talk about chemotherapy, it's important to understand its dual meaning. From a pharmacologic perspective, chemotherapy refers to the use of chemicals to selectively eradicate or inhibit the growth of foreign pathogenic organisms or abnormal cells. The key concept here is selective toxicity, meaning the drug harms the target without significantly harming the host. Historically, the visionary Paul Ehrlich, often called the father of chemotherapy, pioneered this idea of selective targeting, laying the groundwork for many treatments we use today. Clinically, when most people hear chemotherapy, they think of cancer treatment. In this context, it describes a type of treatment that uses powerful cytotoxic drugs to destroy fast-growing cancer cells throughout the body. The effectiveness of antimicrobial therapy hinges on two core principles: selective toxicity and spectrum of activity. Selective toxicity is paramount, meaning a drug must be able to harm or kill invading microorganisms without causing significant damage to the host cells. This is possible because there are fundamental biochemical differences between pathogens and human cells. For instance, bacterial cells have cell walls and unique ribosome structures that human cells lack, providing excellent targets. Fungi also have distinct cell wall components and sterols in their membranes. The other principle is spectrum of activity. Narrow-spectrum antimicrobials are effective against a limited range of microorganisms, which is ideal when the specific pathogen is known. On the other hand, broad-spectrum antimicrobials target a wide array of organisms, useful when the pathogen is unidentified or in severe, life-threatening infections. When considering antibacterial therapies, we categorize drugs primarily into two types: bactericidal and bacteriostatic. Bactericidal drugs, like beta-lactams and penicillins, actively kill bacteria directly. Bacteriostatic drugs, such as tetracyclines, inhibit bacterial growth, allowing the host's immune system to clear the infection. Therapy can also be empiric, meaning treatment starts before the specific pathogen is identified, often using broad-spectrum drugs based on clinical presentation. Directed therapy, conversely, happens once the pathogen and its susceptibility are known, allowing for more targeted, often narrow-spectrum treatment. Sometimes combining two drugs is beneficial, especially for severe infections requiring broad empiric coverage, or when synergy, like a cell wall drug plus an aminoglycoside, enhances efficacy. Combination therapy also helps prevent resistance, as seen in tuberculosis or HIV treatment, or when dealing with mixed infections. However, it's crucial to remember that this approach also carries risks: increased toxicity, drug interactions, higher costs, more intensive monitoring, greater disruption to normal flora, and potentially increased resistance pressure. Antibacterials, also widely known as antibiotics, are powerful drugs specifically designed to treat bacterial infections. Their effectiveness stems from targeting unique features of bacterial cells that are not present or are different in human cells. We classify antibacterials based on their mechanism of action. Some drugs, for example, interfere with the synthesis of the bacterial cell wall, which is vital for bacterial integrity. Others inhibit protein synthesis, disrupting the bacteria's ability to produce essential proteins for survival and replication. A third group targets nucleic acid synthesis, preventing the bacteria from copying their genetic material. Lastly, some antibacterials interfere with folate synthesis, a crucial metabolic pathway for many bacteria, or disrupt the bacterial cell membrane, leading to cell death. Each mechanism offers a unique way to combat bacterial growth and infection. Let's look at some specific examples of antibacterials and their targets. For cell wall synthesis, we have beta-lactams like penicillin and amoxicillin, and glycopeptides such as vancomycin. These are crucial for breaking down the bacterial cell's outer protective layer. When it comes to protein synthesis, a broad category includes aminoglycosides like gentamicin, tetracyclines such as doxycycline, macrolides like azithromycin, and oxazolidinones like linezolid, each acting on different ribosomal subunits to halt protein production. For nucleic acid synthesis, we find fluoroquinolones like ciprofloxacin, which target bacterial DNA gerase, and rifamycins such as rifampin, which inhibit RNA synthesis. Metabolic pathways are targeted by sulfonamides and trimethoprim, inhibiting crucial steps in bacterial folate synthesis. Finally, drugs like colistin from the polymyxins class disrupt the bacterial cell membrane. Antivirals are a distinct class of drugs used to combat viral infections, but they come with unique challenges. Viruses are obligate intracellular parasites, meaning they must hijack the host cell's machinery to replicate. This makes it incredibly difficult to achieve selective toxicity without harming the host cells themselves. Furthermore, viruses have high mutation rates, which unfortunately leads to rapid drug resistance, making treatment complex. Despite these hurdles, antiviral drugs work by targeting specific steps in the viral replication cycle. This can include blocking attachment and entry of the virus into host cells, preventing the uncoating process where the virus releases its genetic material, inhibiting genome replication by targeting viral enzymes, preventing the synthesis of viral proteins or assembly of new virions, or blocking the release of new viral particles from the host cell. Each stage offers a potential point of intervention. Let's explore some specific antiviral examples. For targeting attachment and entry, drugs like Maraviroc are CCR5 antagonists for HIV, and enfuvirtide is a fusion inhibitor. To prevent uncoating, adamantines like amantadine are used for influenza A. Nucleic acid synthesis is a major target. Nucleoside peptide reverse transcriptase inhibitors, NRTIs, such as tenofovir, and non-NRTIs, NNRTIs, like efavirenz, are crucial for HIV. DNA polymerase inhibitors like acyclovir target herpes viruses, and sofosbuvir inhibits RNA polymerase for hepatitis C. For integration into the host genome, integrase inhibitors, INSTIs, like dolutegravir, are vital for HIV. Assembly and maturation are targeted by protease inhibitors, PIs, such as ritonavir for HIV. Finally, to block viral release, neuraminidase inhibitors like oseltamivir are effective against influenza A and B. Antifungals are designed to treat fungal infections, but like antivirals, they present significant challenges. Fungi are eukaryotes, meaning their cells share many similarities with human cells. This close resemblance makes it difficult to achieve selective toxicity, as drugs that harm fungal cells can also potentially harm host cells. Fungal infections can range from superficial skin conditions to life-threatening systemic infections, each requiring different therapeutic approaches. Antifungal drugs primarily target unique structures in fungal cells. Key targets include the cell membrane, specifically by interfering with ergosterol, which is the fungal equivalent of cholesterol. Another target is the cell wall, by disrupting components like beta-1,3-D-glucan. Some antifungals also inhibit nucleic acid synthesis, preventing the fungus from replicating its genetic material. Understanding these specific targets is crucial for developing effective and safer antifungal treatments. Let's consider some key examples of antifungals based on their mechanisms. Polyenes, like amphotericin B and nystatin, work by binding to ergosterol in the fungal cell membrane, creating pores and causing cell leakage. Azoles, which include imidazoles and triazoles, inhibit ergosterol synthesis, thereby disrupting the integrity of the fungal cell membrane. Echinocandins, such as caspofungin, target the fungal cell wall by inhibiting the synthesis of beta-1,D-glucan, a crucial structural component. Other important antifungals include flucytosine, which interferes with fungal nucleic acid synthesis after being converted to a toxic metabolite, and griseofulvin, which inhibits fungal cell division by binding to keratin and disrupting microtubule function. Each class offers a distinct approach to combating fungal infections. Antiparasitics are a diverse group of drugs used to treat parasitic infections, which are broadly categorized into protozoal and helminthic infections. Protozoal infections include diseases like malaria, caused by Plasmodium, amoebiasis, and giardiasis. Helminthic infections are caused by worms, such as nematodes, which are roundworms, and cestodes, which are tapeworms. These infections can cause a wide range of symptoms and can be particularly challenging to treat due to the complex life cycles of parasites and the potential for drug resistance. When it comes to antiparasitic examples, we have specific drugs for different types of infections. Antimalarials include drugs like chloroquine, artemisinin derivatives, and mefloquine, each targeting different stages of the Plasmodium life cycle. Anti-amoebic and anti-giardial drugs like metronidazole and tinidazole are effective against protozoa causing intestinal and systemic infections. Antihelminthics such as albendazole, mebendazole, and praziquantel are used to treat various worm infestations by paralyzing or killing the parasites. Antimicrobial resistance is a growing global crisis. It's defined as the ability of microorganisms to resist the effects of an antimicrobial drug to which they were once susceptible. This means that once effective medicines lose their ability to treat infections. The mechanisms by which microbes develop this resistance are varied and sophisticated. One common mechanism is enzymatic degradation or inactivation, where bacteria produce enzymes like beta-lactamases that break down antibiotics such as penicillin. Another is the alteration of the drug's target site, as seen in MRSA, where Staphylococcus aureus modifies its penicillin-binding proteins so antibiotics can't bind effectively. Microbes can also develop efflux pumps, actively pumping the drug out of their cells before it can act. Some reduce their permeability or uptake, preventing the drug from even entering the cell. Others can overproduce the target enzyme that the drug inhibits, overwhelming the drug's effect. Finally, some develop bypass pathways, creating alternative metabolic routes to circumvent the drug's action. These sophisticated strategies allow bacteria to survive and multiply even in the presence of antibiotics. Combating antimicrobial resistance requires a multifaceted approach involving everyone from healthcare providers to policymakers and patients. A critical strategy is adhering to the 5R system for antimicrobial use, ensuring the right patient receives the right drug, at the right dose, at the right time, and for the right duration. This promotes the rational use of antimicrobials, preventing overuse and misuse. It's essential to promote appropriate use of these vital medicines, ensuring they are only prescribed when truly necessary and for the correct infection. Furthermore, investing in research and development of novel antimicrobial agents is crucial, as we constantly need new tools to stay ahead of evolving resistance. Equally important are robust infection prevention and control measures in all settings to reduce the spread of resistant organisms. Finally, diligently tracking resistance patterns helps us understand where and how resistance is emerging, allowing for better informed treatment strategies and public health interventions. Now let's shift our focus to chemotherapy, specifically in the context of cancer treatment. This field also involves using chemical agents, but here, the target is abnormal, fast-growing cancer cells within the body. There are several classes of chemotherapy drugs, each with a distinct mechanism of action. Alkylating agents, like cyclophosphamide, directly damage DNA, preventing cancer cells from replicating. Antimetabolites, such as methotrexate, mimic natural substances, interfering with DNA and RNA synthesis. Anti-tumor antibiotics, like doxorubicin, intercalate into DNA, blocking its transcription and replication. Mitotic inhibitors, like paclitaxel, disrupt cell division by affecting microtubules. Topoisomerase inhibitors, such as etoposide, interfere with enzymes essential for DNA replication. Hormonal therapies, like tamoxifen, block hormones that fuel certain cancers. Targeted therapies, such as imatinib, specifically attack cancer cells by interfering with particular proteins involved in tumor growth. And finally, immunotherapy, like pembrolizumab, stimulates the body's own immune system to fight cancer. Thank you all for your attention throughout this lecture. I truly appreciate your dedication to learning these complex and vital principles of pharmacology. As we conclude, I want to leave you with an important thought. When life is hard, remember, it's in these moments your strength grows and deepest learning occurs. The challenges you face, whether academic or personal, are opportunities for profound growth. Keep pushing forward, stay resilient, and always believe in your capacity to overcome obstacles and achieve great things.